Austin-Weston, the Center for Cosmetic Surgery, is proud to present the New You Now podcast, today featuring Dr. Rob Sigal. And now, here's your host, REBECCA BENNETT and Dr. Sigal.
Can you take your thumb and bend it down to your wrist? Pretty far?
Is that
No,
far?
that's about normal. No, that's pretty far. So that suggests to me that your skin is not going to age all that well.
Uh-oh.
Pretty good.
Glad I know
Pretty
you.
good, right?
Okay.
Let's do this.
How's it going?
It's going great.
Good.
It is going great.
How was your week? What surgeries did you have this week?
This week seemed like it was a body week. I think we started out with some breasts earlier on,
Okay.
then moved into some more tummy tucks. Liposuction, big case yesterday, where we integrated a couple of interesting technologies, not only just taking liposuction, which is, removing the fat with these cannulas or long, skinny tubes, but we also introduced some tightening mechanisms to the surrounding tissue of the fat. Like if, here's the skin and here's the muscle. It's not just a lake of fat between the things. Mm-hmm. Like it's more like a sponge, and the air cells would be the fat. And the sponge part is this connective tissue. And so when you go through with a cannula in different directions, you're removing the fat. Now you got this sponge that's left. And so we can tighten that sponge with some ultrasonic energy. That's called a vaser, right? It sounds like laser, but it's really ultrasound. Laser's light. And then we can tighten the skin part with radio frequency. And so we did all of that yesterday. And I saw her back this morning and took 5+ liters out of fat. And she had like almost no pain, almost no bruising.
Wow.
She's going to be back in her life really quickly.
When you do liposuction, do you have the cannula itself? Do you have to make a cut and then stick the cannula in, or
Yeah.
how exactly does it work when you?
Yeah, you
use
make
the
a little
cannula?
tiny cut. I mean, so the cuts are that big, which
Oh,
is
wow.
what, maybe the biggest cannula I use is 5 millimeters wide, right? And I go down from there. The tips of the cannulas look a little bit different sometimes, but generally it's 5 millimeters is the width of the thing. So you make a 5 millimeter cut and you try to hide them, right? Put it in the belly button or in a crease somewhere. A couple of cuts you can't really hide very well, like on the sides, for example, under the bra line in the back, if we're liposuctioning the back. We suctioned this woman's face yesterday as well as the body. There you can hide and those are tiny cannulas. Those are max 3 millimeters. Max,
Wow.
and they go down from there. And so you can hide those cuts really easily. That's just a tiny little nick.
And do those scars fade over time?
All scars should fade over time.
Yeah.
Yeah, some people don't make good scars. That's pretty rare, but all scars are always going to be there. It's just a question of how fine they
Right.
become and where they hide.
Okay.
That's weird about scars. There's we think in terms of keloids or hypertrophic scars, like thickened kind of scars. Have you ever seen those?
Mm-mm.
You haven't seen them?
Mm-mm.
We see them a lot. I used to go down to Haiti, and down in Haiti, you would see these ear keloids where somebody went and pierced the little baby's ear or something, and then this monster scar would grow almost bigger than the ear. And that's really problematic. And the problem is we don't really know what provokes it because no animals make those kind of scars, and there's no animal model to study. So we've always struggled with what gene does that and how to treat them. We can treat them, but we don't know why it happens.
Wow. Well, I'm glad that you did liposuctions this week because that means that you're refreshed. Because today we are going to be debunking myths.
My mind is refreshed on it, but
He's got the coffee.
yeah, got the coffee.
We're going to be debunking myths about liposuction. And I found this list from the American Society of Plastic Surgeons. They have this
Those
nifty
guys?
list. Yes,
Oh my
this
God.
nifty list. So we're going to go through them and see what you have to say about them. The first one I think is probably the most common misconception about liposuction. Liposuction can help you lose weight.
Yeah, so I know why they would say it. I think a lot of people think that liposuction is instead of losing weight. Like you're going to lose weight with the liposuction, therefore I don't have to be I don't have to worry about my weight. And that's not what liposuction is about. Liposuction is about shape and not weight. But what's kind of messed up in that is that you will lose weight because I'm taking fat away, right? So in the beginning, I put a bunch of fluid into that sponge, to expand the space a little bit. That fluid has anesthetic in it, and it also has vasoconstricting agents, epinephrine in it. And that keeps you from hurting and bleeding, right? But it's also a lot of volume. So even though on that lady yesterday, I took out 5 liters of her fat, I think I put in probably 16 liters, And a lot of that comes out, but there's still going to be some weight that you gain from the fluid. And so I think this morning she was about 7 pounds more than when she was preoperatively. And,
my goodness.
But she's going to lose that, right? I mean, she's going to pee it out over the next few days. And then at the end, we check you at 3 months. At 3 months, you should be, if I took 5 liters out, she should be, 10 pounds lighter. Now, if you aren't, you gain weight. And you can put weight into fat that I didn't take out, the fat that I left back in place, right? So there's a lot of fat that you have. I know you know what an omentum is, but a lot of people don't, right? Like an omentum is this really weird apron of fat that lives under your muscle in your abdomen. And it's a real thing. Like it's just these blood vessels that come off the greater curvature of the stomach and the transverse colon, just FYI.
Thank you.
Okay. And what that does, we have no idea really, but it seems like it protects it's like the guardian of the abdomen. And any infections that you get, like diverticulitis or appendicitis or something, it walls it off and keeps it from killing you. Could still kill you. So go to your doctor if you get appendicitis. Don't do that one at home, okay? But it's, that stuff can get very big. If I've taken, and so like if you have liposuction, and I do a really significant liposuction on you, take off 5 liters of fat, and you do gain weight, you're going to put it in really weird places, and you're going to look odd. So the best candidate for liposuction is fit, is stable with their weight. They're not like yo-yoing all up and down. And they just have a deposit or an area that is problematic for them. And that's the perfect candidate. The skin is pretty good and it's going to contract. The sponge is going to contract.
So if I have extra weight that I want to lose, I should lose it after I have lipo.
Yeah, I mean, but not a lot, right? Like, you want to come in stable.
Okay.
But don't get down to it. Don't diet first, right? I mean, like if you diet and lose 20 pounds and then come in for liposuction, well, I mean, what are the odds that you're going to gain that 20 back, especially if you have a history of doing that in the past of your life? So don't do that. You're not going to be happy. I'll be a hero if you lose the 20.
Well, this myth kind of piggybacks off of that. It says liposuction is, quote, the easy way out.
The easy way out.
Which I'm assuming you probably hear a lot in plastic surgery. The people think that, instead of going to the gym, they're just going to go and get plastic surgery done.
Well, I mean, it's like the people that would say that generally don't come in here, right? The people that come in here have already committed to the liposuction. They've tried the gym. They've done the gym. They are frustrated by where they got to in that whole journey, and they want a little bit of help. Some people come here first. Like, for example, this whole COVID thing has been real problematic for people. It's like the COVID-19, It's like the freshman 10 or something, So they want a little bit of a jump start getting back into the gym, and I don't think that's unreasonable. I see that all the time. Like, I often tell people, I'm going to do my best for you, but then you got to help me help you. I can only do so much, and then you're going to have to maintain it. And I have conversations every time with people about diet a lot and exercise a lot because, I'm really fascinated by it. I was an NIH cancer and nutrition fellow for a couple of years and wrote book chapters on nutrition. And I was a champion rower in college. And so I know what exercise can do for your body, and I know what nutrition can do for your body. And I think there's a lot of myths out there as to what nutrition is and how to eat and how to lose weight nutritionally and how much exercise is good and how to exercise. So I like having those conversations with people, and people that come in here are really very engaged in those topics to begin with. I learn a lot from my patients many times. Really, they provoke me to think about things I haven't thought of in a while and think about differently.
The next one is liposuction can treat cellulite.
It really can and can't. All these things are like half true, It's like, man, I mean, so what is cellulite? Cellulite is actually pseudocellulite. Newsflash. So cellulite babies have. It's when you have like a quilted couch where like there's a button at the bottom of like these quilts, on the couch. That button is cellulite. Where, remember we were talking about that sponge? Well, it's not like here's the skin, here's the muscle, and here's the sponge of fat. The little like attachments to the underside of the skin are the buttons on the quilt on the couch. And that's what causes cellulite. It'll create like a little dimple, where it attaches. And like if you take a baby's thigh and you kind of squeeze it or something, then you can kind of see those attachments show up. As we get older, gravity, laxity, whatever, it'll exert its effects on the skin and that sponge. And when you stand up, for example, your skin will kind of slide off your muscle a little bit, and then those attachments will come into play, and they'll grab the skin, and that's where you'll see the actual pseudo-cellulite. If you stand on your head, that cellulite goes away, which is really kind of cool. Try it sometime. It's neat. Not that you have any. You at home. But liposuction in the context of those attachments, right? So in theory, you're expanding that sponge with your fluid, and you're putting your cannula in there, and you're taking out the fat. You could knock into some of those attachments, and that might make the cellulite better, right? Or you miss all of them and you don't change it at all. Or you could, maybe get a little bit of blood next to one of these things. It's going to contract down on that little attachment and make it worse. So I don't know how to even answer that myth, right? It's like, it's way more complex than what they say. I guess as is anything, once you understand it pretty well. But,
right.
yeah.
All right. And the next one is liposuction is not for older people.
It's not for the faint of heart, not for sissies.
Yeah.
It's older people. The older I get, I'm not even sure what an older person is anymore. Like, I used to think I would be an older person, but like, honestly, I'm 35 years old inside. I don't know, man. I mean, it's really about the quality of the skin, right? So if you're one of these yo-yo diety kind of people, and your skin is, just kind of shot because you've gained 50 pounds and lost 50 pounds and over the years many times, you might not be an older person, then you might not be a candidate for liposuction. Or if you're 27 years old, you've had 3 kids, and your skin didn't retract very well, you're not an older person, but you're not a candidate for liposuction because your quality of your skin isn't good enough. It's like there's not enough of those dermal attachments, those little things that are in the cushioned couch, to really contract down at the end of the day. So it's not about age, it's about quality of skin. Generally, older people's skin isn't that good as compared to younger people, but you can liposuction older people for sure.
What would be the alternative if you don't have the right skin for liposuction?
No, you're cutting it. I mean, like, if you can't, like, a tummy tuck is instead of liposuction, or a bra line back lift is instead of liposuction. Now we've got like more and more modalities to help tighten the skin. Like I was talking about, that Vaser and the radiofrequency probe. Those things will help tighten the tissues for sure. But it's not ultimately as good as tightening the skin with cutting. And so that's where the judgment of like all of these years of cases, I mean, I must have done, I'm easily into 5 figures, 10,000 plus liposuctions over the years. And after a while, you kind of get a sense of what's going to work. And it's very rare anymore that I'm stuck between cutting or sucking. Like it's cutting or it's sucking. Every once in a blue moon, you find somebody in the middle, and there you have a different kind of conversation. There it's like, well, look, here's what I think you can reasonably expect. Are you going to be okay with this? Or, this is really kind of what I think you need. Are you going to be okay with the scar? It depends what people's expectations are, which is really all about cosmetic surgery. It's all about expectations.
And as far as the scarring goes, where do you typically see scars?
For liposuction? Well, wherever you make your little cuts, right? So if I try to hide the cuts, and if you look, you're going to see them.
Yeah.
I mean, on the face, it's hard, you won't see them because those are tiny cuts behind the ear or something. In the belly button, not going to see it. On the sides, you'll see it if you look real hard. And in the back, you'll see it. Back skin is different. It's much thicker, right? I mean, if you look at back skin, it's, 3 millimeters thick. Eyelid skin is the thinnest skin on your body. And the thicker the skin, the more proclivity. Ooh, there's a word.
SAT words.
I haven't used that in forever. Proclivity to scar, like in a thick way, Eyelid skin, I don't think I've ever seen a thick scar. Back skin, yeah, every once in a while you see it.
Interesting.
Is it?
It is. Proclivity.
Proclivity.
This myth, I think, is a loaded one. That liposuction.
You said something really kind of weird, like you took your elbows and rotate them out. Can you take your thumb and bend it down to your wrist? Pretty far?
Is that
no,
far?
That's about normal. No, that's pretty far. So that suggests to me that your skin is not going to age all that well.
Uh-oh.
Pretty good.
Glad I know
Pretty
you.
good, right? So that's like the density of the collagen around your joints is the density of your collagen throughout your body. And if you can take your thumb and bend it really down to your wrist, those are people like with liposuction I got to be a little bit careful with. Try to think about that.
Why did you think that when I did? Because I'm
like you can
double
hyperrotate.
jointed.
Yeah, you can
Huh. Interesting.
extend your
Well,
elbows.
good to know. I'll keep your number.
Little
I know
consult
where you
right
live.
there, huh?
Okay, so this one's kind of a loaded one, that liposuction is dangerous.
Yeah.
What do you tell people when patients are like, oh,
I would
it's
say, like,
dangerous?
don't try it at home.
Yeah.
But no, I mean, if you come to a place where we've done 10,000 of them, I think you're going to be, pretty much have it down. Now, look, there's two things about liposuction that are dangerous, right? One is the cannula. It needs to stay in the fat. Like, you start putting it into organs, you're going to have a problem. Okay, so that's a beginner. I mean, that should never happen. Okay. The other thing would be is if you bleed a lot, right? Like if you don't use enough fluid in that sponge and you don't really vasoconstrict the vessels and you get a lot of bleeding, then you're going to have fluid shifts, and fluid shifts can be dangerous, and you've got to pay attention to that. But by and large, it's a remarkably safe surgery. I mean, there's way more scary surgeries than liposuction. The myth was that it was dangerous. Well, it's not dangerous. That's a myth then, right? Mm-hmm. Okay, good.
How soon can you return to your normal routine after you have liposuction?
Well, so that's like people always say, like, when am I recovered? Well, for what? Like, what is your routine? Like, are you going back to Zoom work? Well, you can do that the next day. You got to take care of a 4-year-old. You're gonna good luck with that. Depends how active they are. You're gonna need some help. You can drive a few days after liposuction. You can go into the office probably a week or so. You can fly 2 weeks. You can go back to the gym on a gradient, like sort of depending on what you want to do. So you can go back to walking on a treadmill at an incline, elevate your heart rate after a week or so. I don't want you bouncing like on a basketball court. I think jiu-jitsu is probably a bad idea, but you're getting back in your life pretty quick. We see you back at 3 months and say, how'd you do? Because at that point, we can kind of rework with the tissues. They're not hard, they're soft again. And we can, like, if we have any things we want to enhance, we can do it then.
Well, thank you. This was fun.
I enjoyed it. Thank you, Rebecca.
Hey guys, thanks for tuning in to this episode of Austin-Weston's New You Now podcast. If you liked what you saw or heard on today's episode, please like and subscribe to our channel. And if you have any questions about any of the topics we've covered today or in past episodes, send us an email at hello@austin-weston.com or just leave us a comment below. See you next time.
For more information, visit austin-weston.com or call our offices for a consultation, 703-893-6168. And make sure to subscribe to our podcast series, Austin-Weston, the Center for Cosmetic Surgery.